Did you know that cervical cancer is almost entirely preventable, yet it remains one of the most leading causes of cancer deaths in women? And over 600 women globally die. Why am I saying this? Because January is Cervical Cancer Awareness Month, and I want us to have a broader and more understanding of this and how we can prevent it and just live healthily. And I've sat down, did a thorough research on it, and I'll present it to you guys. So tag along and be informed about this. During this talk, I'll also be talking about the most leading cause of cervical cancer, which is HPV. HPV is human papillomavirus. So there are so many, there are different causes, but 99% of the cause is HPV. Cervical cancer is cancer that starts in the cell of the cervix, the lower part of the uterus. Let us talk about the causes and risk. Where one of the major causes I've already mentioned is HPV, human papillomavirus. It's the most common sexually transmitted infection. Men are known to be carriers of the virus and transmit it to women during sexual intercourse. Most sexually active individuals contact it at some point in their lives, and some may resolve in their own without causing any symptoms. Let us discuss about the types of HPV. This include the low risk types causing warts, to the high risk type causing cancer such as cervical cancer, anal cancer, throat cancer, vulvar and perineal cancer. Primary causes of HPV is direct to direct skin contact, vaginal and or oral sex, though close contact with infected areas even without sexual intercourse, sharing personal items like razors, but rarely. Risk factors: having multiple sexual partners, early onset of sexual activities, weakened immune system, e.g. smoking, HIV and other conditions can weaken your immune system, thus risking you to getting this infection. Lack of vaccination against HPV. This is the most important part. How we can prevent this disease from getting us, this cervical cancer, is by getting vaccinated against the HPV, which is the most common cause of cervical cancer. Vaccination is usually administered at the age of 10 to 15 in Kenya, currently for both boys and girls. This early vaccination makes it most effective. Vaccination protects against high risk of HPV strains, e.g. type 16 and 18. Safe and effective for both males and females. You'll see some other people saying from age 9 to 12, but it's usually most effective before someone starts engaging in sexual activities. But there is a catch-up vaccination, and it's advised for individuals up to the age of 26 if they didn't get it earlier. Adults from 27 to 45 years may benefit, but advised to ask a healthcare provider if it's appropriate. Secondly, safe sex. The first way of preventing HPV is vaccination. The second way is safe sex. Kindly use condoms, limit number of sexual partners, and avoid early onset of sex. Also use dental dams. The third way of preventing HPV is screening. Regular pap smear for women and HPV testing can detect precancerous changes early. It's advised that for screening for women aged 21 to 29 years, every 3 years is the right recommended variation of the screening test for HPV. But for women over 30 to 65 years, it's recommended that you do the screening every 5 years to determine, and it's usually combined with the HPV test to determine if you have the virus, I would encourage this frequent tests just to detect the cancer cells early. If we detect cervical cancer early, it's really easy for us to treat it, and therefore living healthily and without any risks like this. So the fifth way is quitting smoking. Smoking weakens the immune system, increasing the risk of HPV persistence and related cancers. Smoking really weakens your immune system, and it increases the HPV persistence, okay? And HPV is by far the leading cause of cervical cancer. So please guys, I really want you to take these notes of HPV so serious and make them effective, and please get vaccinated. If you are a mother, at the age, take your child from the age of 10 to 15 for vaccination, both males and females. Other causes of cervical cancer may include lifestyle factors, immune health, and environmental influences. How does HPV cause cervical cancer? HPV can integrate into cervical cells and disrupt normal cell regulation, leading to precancerous changes and eventually into cancer if left untreated. Also, another cause of cervical cancer is genetic predisposition. Secondly is weakened immune system. We have mentioned smoking. There's also HIV and AIDS, and use of immunosuppressive drugs. And the third cause is long-term use of oral contraceptives. Yeah, for women this will likely highly affect us, but it has been researched that long-term use of oral contraceptives causes cervical cancer more than 5 years. And 5, multiple pregnancy. Yeah, this research says that for women who have carried multiple pregnancy to term are at high risk of having the cervical cancer. 6, early sexual activities and multiple partners. Please kindly advise our children, our young ladies, do talks for them not to get involved in early sexual activities, and also for us to limit the number of sexual partners we have to 1. Lack of regular screening also causes cervical cancer. Recommended every 3 years. That one we've mentioned for women age 21 to 29, and every 5 years for women above 30 to 65, and it's combined with the HPV test, okay? The other way we can prevent the cervical cancer is by boosting our immune system. This we consider so much with the balanced diet like fruits and vegetables to support the cells repair, and regular exercise to strengthen our immune and also avoid stress. When do we see a doctor? We see a doctor if you notice any of these symptoms that I'll read below: irregular bleeding, e.g. after intercourse or between your periods, pelvic pain or discomfort during intercourse, unusual vaginal discharge, watery, bloody or foul smelling, okay? So that's pretty much about it. I'll repeat those signs again when you need to see a doctor: irregular bleeding during intercourse or in between your periods, pelvic pain or discomfort during intercourse, unusual vaginal discharge, watery, bloody or foul smell, okay? I'd like to take this opportunity to wind up by saying for women, we need to get vaccinated, we need to schedule regular screening, please, and we need to watch for symptoms and consult a doctor if need be. The symptoms I've mentioned. For parents, ensure children, both boys and girls, get HPV vaccine at the recommended age, mostly from 10 to 15 in Kenya, and most government hospitals for children are giving these vaccines for free, even including the private hospitals, and at a small fee for adults. So for the community, let's promote awareness and advocate for accessible healthcare resources. Please, if you know someone out there who is still not aware of the benefits of HPV and is really against it, please advise accordingly and let them take their children for this vaccine. Most public hospitals, e.g. the Kenyatta National Hospital and Kenyatta Teaching Referral Hospital, offer this vaccine for free. It's really available. Even the screening is there in this hospital, so don't hesitate. And also healthcare providers are there to assist you whenever necessary. Maybe you'll be charged a small fee for registration, but the vaccine itself, it's given for free. My part in short is cervical cancer is one of the most preventable and treatable cancers when caught early. Together, we can eliminate it as a public health concern. And if you have any other questions, you can have it in my comment section. I'll address it in my next video. And this has been your health segment with me, Queen Shaz. Stay tuned for more videos. And yeah, thank you for watching, and I love you all. Bye bye.